most people are overpaying for their Medicare coverage because they picked the wrong Medicare supplement company. Here's the thing. The company that you've had in the past for your employer health insurance or other insurance is likely not your best Medicare supplement company. But on the other hand, because of Medicare's rules around pre-existing conditions, we also don't want the cheapest plan either, because they could instantly increase rates in the future. So there's a delicate balance to find that best Medicare supplement company to both protect your money, but to also avoid future rate hikes. So in this video, I'm going to talk about the 6 things to consider to help you find which Medicare company is best for you. I'm Emily with the Medicare Coach. We are the leading independent Medicare consultant, helping our clients easily navigate Medicare rules and insurance company options to help them protect their healthcare rights, but also their hard-earned retirement savings. We look forward to helping you here at the Medicare Coach to make your right decision, because Medicare can be fantastic when you do what's ultimately right and best for you. So let's go to hop into this. There's 6 things to consider when it comes to picking out a Medicare supplement company. I hear this question all the time in my free online Medicare workshop, where I cover this in more detail. If you have not already joined that free workshop, click the link below and sign up. I look forward to seeing you on the live workshop to go through your questions there. But step number 1 to consider is, what is the financial rating of the company, okay? So when we're picking out a Medicare supplement company, we want to look at both the price, but also the long-term impacts of your decision. Medicare rules say that when you first join Medicare in that 6-month window, you have what's called your Medigap open enrollment, where you can join any Medicare supplement plan, also called Medigap plan, no matter what your pre-existing conditions are. However, once that window passes, in most states, you are not guaranteed to change Medicare supplement plans or even companies. So we want to be very thoughtful around the company that you first pick, the plan that you first pick, as you'll likely have that for the rest of your life. So that's why it's so important to pick this right company initially. And the first thing to consider, as I mentioned, is the financial rating of a company. So financial rating is determined for companies by private companies, okay, who analyze companies to determine how stable or how risky they are, okay? And if a company has a higher rating, they tend to be more stable, which means they should be able to keep your rates lower in the long term. So we like companies that have a higher financial rating, meaning that they're more stable, they're more secure, and they should have more stable rate hikes in the future. Now, the second thing to consider is the years in the market. Are they brand new to the market, or have they been in the market for over 50 years or whatever it is, okay? New companies in the market tend to come in with very aggressively low prices to gain market share. But what we've seen in the past is that in the future, they'll increase their rates substantially. And because we don't have the wiggle room in most states to change Medicare companies, we usually want to avoid those brand new companies into the market to see how they're going to behave and what the real prices of the plans are before you sign up for them. Number 3 is customer service. Again, because of the long-term nature of these contracts, we want a company that does provide you good customer service. They help you resolve bill issues, they help you resolve premium issues, all of those things. We want a company that's by your side to make this as simple and easy as possible, because you want your Medicare coverage to be as simple and easy as possible as well. Number 4 is the pricing structure. There are 3 different ways that a Medicare supplement policy can be determined. One of the most common is it's called the community rated age. And there are pros and cons to that, as well as the attained age or the issue age. My point is I don't have time to go into all the definitions of how they're defined in this video, but based on how a plan is rated, how the pricing is structured, there can be pros and cons to both. In most cases, we prefer that community-based rating as long as that premium is competitive to the other plans in the market, okay? But it tends to have a bit more of an advantage, but not always. Number 5 is the ultimate price, right? What will you pay for this plan? We tend to see that some of those name brand companies that we all know on a regular basis, they tend to charge more for their Medicare supplement plans for no real reason. And so that's why in this video I said if you're going with that company that you've already always used, you're probably overpaying for your Medicare supplement coverage. These name brand companies tend to know that they can charge more for brand loyalty, and that's fine if you want to stay with that company, but at least be aware of the fact that paying more for certain companies might not always make sense. And number 6 is extra perks. This might sound a bit odd because usually those extra perks like the gym memberships go with Medicare Advantage. But there are some companies in certain areas that add extra perks onto their supplement plan Gs. And for that reason, if an extra perk thing is helpful for you, it can be worthwhile to look at those extra perks. Are the companies offering those to have you to join one plan or the other? So again, those are the 6 things to consider when it comes to deciding which supplement company is best for you. Do not assume anything. Do the research, make an informed decision. And if you want more help when it comes to Medicare, make sure you click on the link below and register for my free online Medicare workshop. Otherwise, like the video to get more inside tips to help you easily make your right Medicare decision.